Hello, welcome back to the NCCDP YouTube channel. I'm your host, Alexandria, and today we're going to be talking about the ADL tug of war with Kari Johnson. Welcome back again.
Thank you. Thank you for having me.
Of course. Before we get into the topic, can you just share a little bit again about who you are and what you do, just for anyone that hasn't maybe watched the previous videos with you?
I am an occupational therapist, a board-certified patient advocate, an educator, and I have worked with older adults in some capacity since I was 17. So I've worked in every environment, and I also had a parent with dementia as well. So I have lived and worked and been around dementia for many, many years. I'm in my mid-40s, and I've been in healthcare over 25 years.
So she knows what she's talking about.
Well, I at least pretend to.
We can trust you. So before we even get fully into nitty gritty of the stuff, what does ADL stand for?
That's a good question, Yeah, that's a good question.
Starting off point.
Yeah, because when you say that, I've said it to families before, oh, they're ADLs, activities of daily living.
Okay.
So that would be your washing, your dressing, your bathing, toileting. But then there's also IADLs, which I don't know that I had mentioned before, instrumental activities of daily living. And that would be medication management, shopping, taking care of a pet, financial management, etc. Those are two areas that occupational therapists are assessing. And then when I work with people, it's for the goals are set to be able to do those activities with better ease, or to be able to do them alone.
So then what does the ADL tug of war mean?
Oh boy. So in dementia care, ADLs, when I teach, people constantly ask, well, how do we manage resistance? How can we stop resistance during ADLs? And I always say the approach. Everyone thinks that it's something that the person with dementia needs to change. The tug of war happens because someone walks into a room, flips the light on at 7 a.m. and starts to try and take someone's clothes off and can't understand why they're striking out and agitated. A tug of war starts because they don't know why there's someone in their personal space and who they are or why they're doing what they're doing. So that's where the tug of war comes, where the caregiver is just giving care. They're not care partnering. They're not doing it together. They're just going to give it, whether that person wants it or not. The only place that routines have to be that strict are jail and the military. And that's not where we're at. So that tug of war, as I said, when I teach, people say, well, how can we stop that? How can we stop resistance? And it starts with you. It's not a they problem. It's a you. It's an us problem. It's not their fault. It's our approach.
So then who is to blame for the tug of war that's happening?
I wouldn't say that there's anybody necessarily to blame, but there's a responsibility to know how to assess and how to approach that person. They may have sensory processing deficits, meaning that the water feels hot even though it's not, or it feels cold. With sensory processing, that is really at the core of dementia. It's the process of the brain taking in information from our environment, internal and external, and making sense of it and knowing what to do. And so being able to assess for that, knowing that that person has neuropathy or has central post-stroke pain and that a shower head is going to feel like needles, adjusting that, the only way you would know to do that is with assessment, taking the time to know. So it's not blame, but I should say it's the responsibility of the care partner to assess what the needs are. Because you would do that with someone with a broken leg or any other diagnosis. You would assess what can they do and what do I need to help with. This isn't any different.
So how can we change, or how can we improve?
Really getting back to the assessment and looking at this person's life history. What was their routine when they were younger? What are their preferences now? Providing an environment that's not scary, slowing down. For some individuals, it may be that it's just going to be a wash up. It's not going to be a full shower or a full bath. In this generation, the wash and set is pretty common, where women get their hair rolled, and
Oh yeah.
you're a little bit younger
what?
than me. You're like, what's the wash and set?
Haven't heard that wording for it.
Well, if you've ever been to a skilled nursing facility on a Saturday and they have a salon, there'll be a line of people waiting for their hair to be washed, rolled, dried, and then sprayed with a copious amount of hairspray. And so for that person, if their routine is broken and someone comes in and starts to wet their hair down, they may be sitting there anxious about the fact that, well, who's going to do my hair? And so they've got all this angst and you don't know. So I guess it gets back to assessment again, getting to know the person, stranger danger. I mean, why would we expect more from them than we would of ourselves? Because if I was a stranger to you and tomorrow morning I walked into the bathroom while you were using it, or I pulled your covers off, what are you going to do?
I'd be freaking out.
Absolutely.
Who are you? What are you doing?
Why would this be any different?
Yeah.
And people say, well, I've worked with them for years. Every day is a new day for them. And that's what we have to remember.
Like, that must be so startling too, for even like just how you mentioned, even if it was just like without dementia, and then all of a sudden someone's coming in and have this strict schedule that it's like so different from what you do. And then it's like, that's so frustrating and confusing just in general. Yeah. And then adding in the aspect of also having dementia, I don't see how that would help or do good.
And if someone was to say to you, you've just caused trauma, that you're like, I caused trauma? No, I helped them with the shower. Yeah, but that was trauma. That's why they were fighting back, because they were scared. Oh, well, I had to get it done. I mean, who wants to cause someone else trauma when you're there to take care or partner with them? So it doesn't have to be war. It isn't a war. A brush isn't a sword. A shirt isn't armor. It's a shower. Yeah. The other aspect that we need to address is the environment. If it doesn't look like a bathroom, it doesn't smell like a bathroom, they may not know it's a bathroom. If they have difficulty with the sensory processing and some visual perceptual deficits, and you've got a light colored floor, a white toilet, and the water isn't colored, they may not even know that the toilet is there. So they may have the ability to be able to use the toilet, but they can't see it. And that's not because they have impaired vision. They can have 20/20 vision. It's visual perceptual. It's how the brain interprets what's coming in. So setting up the environment so that they can see, okay, there's the toilet, there's the shower chair, the floor is there. So having some high contrast colors if needed. Imagine if you're sitting on a shower chair. You're sitting on a shower chair, it's wet and slippery, and your feet aren't touching the ground, and there's a stranger hosing you down. Doesn't really sound like much of a spa, does it? So looking at environmentally changing things is important also. Having a shower chair at the right height, having a towel on the shower chair so people don't feel like they're going to slip off. Because if they're scared, they're going to resist, stiffen up, and then the person is like, oh, they're resisting. No, they're trying to protect themselves. Yeah. They're trying to not fall. So that's a big thing in terms of environment. Having the right colors, having the equipment that's appropriate for that person at the right height. Well,
you answered my next question.
Oh, I did?
I was going to ask about equipment. What equipment could help? Would you kind of mention with like a shower chair as an example?
There's different types of shower chairs. People don't necessarily know which one to pick unless they've been educated to do that. So utilizing, occupational therapists, physical therapists, or certified somebody that's got education in the area of how to assess someone, their body and their space. Different equipment, there's the tub transfer bench. Those are interesting. A lot of people don't know those exist, where half of it sits outside the tub and the other half is inside. So you sit down on the outside and then just lift your legs over. But there's different adaptations that you need to make sure you don't have a flood. Outside of shower chairs, being able to give them the handheld so that they can control. And then the floor, is hugely important so that it's not slippery. Other things that are available, switching from potentially drying off with smaller towels rather than big towels. Big towels can be very tiring, but the alternative also for this population is using a robe. If they have sensitive skin, maybe you don't want to rub them and dry them down, putting on a soft robe. So there's equipment like hard equipment that would go in the shower, and then there's also those accessory items as well. There's a long-handled sponge so people can wash their feet. You know, there's several different items out there.
So it doesn't have to be a tug of war.
Exactly. Absolutely, it doesn't have to be a tug of war. It needs to start with, you're going to hear me say it 1,000 times, assessment. Assessment of the environment and assessment of the person. You have to do both. And if it's not working, stop. That's what you would want someone to do. If they were trying to make you do something and you didn't want to, you would want them to stop. Well, that's what we need to do.
Again, with the assumptions, with what we talked about in our stigma episode of just assuming, but really they're still people. And
they are, and I understand that care partners are on a schedule. I get that. I know that time is limited. I know that there may be short staffing. I know that there may be a wife taking care of a husband at home. So utilizing the team, bringing people in that can assess different things, looking if there's, you know, a medication that might help, looking at, you know, time of day, all of the different factors. Maybe person, does it have to be, could it be a friend? I mean, if it's someone that lives in a facility, couldn't their friend help them that they recognized from years ago? You know, it doesn't have to be a total stranger. It may be, you know, for them to be able to recognize someone, that makes a huge difference.
I feel like this is like realizing that there's ways to kind of make this a little bit easier for everyone involved can give a lot of hope, because like my limited knowledge of dementia and dementia care, like the first thing I think of are the ADL tug of war. I didn't have those words for it, but that is kind of what I think, or what you see in the movies, or what you hear about from like a friend of a friend, and this person's struggling with that, and it's usually those kind of like basic living situations, but it doesn't have to be.
No, it's all about the approach. It doesn't need to be a war, and it shouldn't be. It's not safe either. Yeah,
that's true. I feel like that could also cause a lot of just dangerous situations.
Yeah, and you also have to look at the type of dementia that someone has. If they have a frontotemporal behavioral variant type of dementia and they're, you know, at risk of becoming highly agitated easily, your approach is even that much more important, so that not only are they safe, you are as well. And that's, you know, that's the thing. There doesn't need to be war. It's not war. It's a shower.
ADL tug of peace.
Yes.
Rebrand. Make it a thing.
Ban the resistance. Yes. It doesn't need to be that way.
Yeah. Well, thank you for sharing all of this. I feel like this is very, honestly, like hope-giving. That's not how people word that, but hopeful, giving of hope. Just knowing that it doesn't have to be that difficult, and that things can be smoother.
Absolutely.
Can go more according to plan, or just have a better experience overall. So thank you for sharing your knowledge with us.
Well, you're welcome.
I hope all of you watching were able to learn something from this episode. As always, if you'd like to learn more, our website is linked in the description. And maybe if you're interested in becoming a certified dementia practitioner, you can also check that out on our website. Thanks for watching, and we'll see you next time.